Functional movement tests can be used on anybody and are a great way of assessing quality of movement and identifying potential movement dysfunction. They involve observing everyday movement patterns such as a squat, standing on one leg, and stepping up and down. These functional movements are of particular importance to the older adult, as the ability or inability to perform everyday tasks will have a big effect on the quality of their life. Their performance is crucial for functional capacity and independence and falls prevention. The aim of these tests is for the client to perform them to the best of their ability with good technique. If you have identified in the screening process that they have structural postural changes, then bear that in mind whilst testing them. For example, if the client has a structural thoracic kyphosis, then by default they will not be able to hold their back into extension whilst performing a squat. So just know what structural limitations you are working with. It is best to avoid over-demonstrating the test movement, as you're wanting to observe their most natural movement. In these tests, you're observing how the client moves, whether the movement is confident and controlled or segmented and unsure, whether there is any excessive stiffness or bending, any muscle dominance or weakness, and what their overall posture looks like. If the movement is less than ideal, then you need to identify what is contributing to that. Is it muscle weakness and tightness, poor control, poor balance, a lack of coordination, or a combination of factors? You need to find which one is the limiting factor, prioritize, and then address these factors. After the intervention of your training program, the goal is for the client to be able to perform the same functional movement test again, but with better technique, increased symmetry, and improvements in their strength and coordination.